Well, we've got Dr. Mark Bentum here, who's a plastic and facial surgeon, and we're going to talk about the complications of PDO Threadlift. How are you doing today?
I'm doing very well. Thanks for having me here on your show.
Yes. So, first of all, what are some of the complications that can occur with Threadlift?
Yes, so some of this complication can be visible sutures. That means that you can actually see the threads right on the skin. This usually happens to patients who have kind of very thin skin, very sensitive skin. Yeah, that's one. And another complication could be pain itself.
Yeah.
And then you can have minor bruising, infection, and the snapping of the threads. Okay. And then we can also have accumulation of blood, which is we call hematoma, inflammation, and finally dimpling.
Yeah. And of course, they're all very different complications, so I suppose the solution is different for each of them if you're going to fix it, right?
Exactly. The complication comes with their own solutions. What we are trying to look at, or what we are trying to do here, is to actually minimize or eliminate these complications. We can do that at all. We are not interested in having complications and going back to fix them, but if we can reduce
Yeah.
this, that is our major goal here.
Yeah, so prevention is better than cure then.
Exactly.
So let's start with the visible sutures. How can you prevent them?
Yeah, so that comes to the quality of the skin, right? So when we are having our consultation, we are looking at the quality of the skin. We are looking at collagen levels, how thick the skin is, how sensitive it is. And then we're also looking at the type of threads that we are going to use. For example, if we have a thin, sensitive skin, this is not a time that we're going to put in something very strong. Rather, we'll use kind of a thin and light thread so that it sits in and blends in nicely with the skin.
Yeah. And some of the others, what are the best ways to prevent it?
We can prevent bruising, and with bruising, it's interesting. We have blood vessels all around the body,
Yeah.
so we may hit one or two. I usually tell my patients to take this supplement that we call Anicare. They can get it on Amazon. Take a couple of them a few days before the procedure, and this helps dramatically when it comes to bruising and swelling.
And bruising is something that would heal on its own after a while anyway, right?
Yes. Cosmetically, it may not look pleasant the first, second day,
Yeah.
but with as the day passes, it will heal on its own. Basically, that's what it is. It's gonna heal on its own. Yes.
Yeah. And let's say you didn't prevent it and you've had the thread lift and you've ended up with some of these complications. Are there ways that you can try and help yourself even after it's too late for prevention?
Yes, so when we have treatments with our patients, we give them home care. That means things they should be doing home to help themselves. And then we also have a 1 week, 2 weeks follow up where they come back to the clinic and then we reassess, look at everything and see if everything is good, ready to go. For example, in the post care, we have infection, for example, where we put band-aids on where we've entered the skin through with the shreds. And then we will have them dress this area probably with a little alcohol and then put back the band-aid, not to open it to air, and that can cause infection. So these are some of the post cares that we can give to our patients.
Yeah. Now, of course, you've actually written a book about this called Complications of Threadlift. What made you want to write a book?
Yeah, that's a very good question. So Threadlift, I've started writing in Korea. That's about 10 years ago, right?
Wow.
And during this time, a lot of publications, books have come out talking about Threadlift, but hardly have we actually seen a book talking about the complications actually of Threadlift. And this is
Yeah.
very important because the patients who are coming in, they are really concerned. For some of them, they've never done anything like that before. So, hey, what about if something goes wrong, right?
Yeah.
What about if I have swelling? What about if I have bruising? What about if I have infection? What about if my skin is too sensitive or I cannot take this pain, all right? When patients look online, for example, YouTube and other videos, they see the procedure as painful, right?
Yeah.
So they do have lingering questions, right? Burning questions. And I think this book does a great job in explaining, and not only explaining the complication, but helping it with solutions, what we
Yeah.
do when these complications occur.
Yeah. And who is the book intended for? Is it plastic surgeons like yourself, or people who are thinking about having plastic surgery done?
Well, this is intended for everybody. For plastic surgeons, it helps them to just be aware of some of the things that can happen or can go wrong,
Yeah.
and then how they can combat that. And for the general public, this is to provide relief and comfort. Okay, knowing that what you are going through comes with complication, but hey, there are solutions out there. There are things that you, as a patient, you can do. The physician also plays a part. And when we come together and we work together as a team, the outcome is very desirable for both the patient and also we as the physicians.
Yeah. And do you think that you could maybe write more books in the future?
Of course, absolutely. This book will be updated continuously as we gather more evidence and informations and data. Because every time we see new things, and not only complication, but we also advance into areas where we can explain much more tolerable techniques of placing threads.
Yeah.
And I think that is very important, and for now and also in the near future.
Yeah, absolutely. Well, in the meantime, where can we find your latest book, Complications of PDO Threadlift?
So this is actually electronic copy, so you don't need any shipment and all that. And listeners can download that right below this interview video. They can download that and then have a copy for themselves. Yeah.
Okay, great. Well, many thanks for joining us today, and have a smashing day.
All right. Thank you very much for having me, and have a wonderful day too.